Hi, Andrew with Smarter HSA. Today I'm going to talk about how to prepare for medical bills in retirement. So there's a lot of sources out there saying that a couple in their retirement is going to spend somewhere around $260,000 just on medical related items. So that would be long-term care, dental, medical bills outside of what your Medicare and your supplement or your Medicare Advantage plan will cover, and then prescriptions. So there's Part D, but there's other costs associated with prescriptions outside of what Medicare will cover. So big number, how do we prepare for it? So no matter what age you are, there's always a way to prepare for it. The younger you are, the more time you have. But really what we're going to focus on is how to use the HSA as an additional retirement account and really preparing to use it for that amount right there. Because anything we put into the 401k, we're going to have to pay tax on. So we don't want to do that until we've maxed out our HSA. So unless you're getting an employer match, we really want to focus on if it's just you on the health insurance, the amount you can put in is $3,500 a year. So single. If you're on family coverage, you can put $7,000. This changes every year. So this is the 2019. If you're 55 and older, you can actually put an additional $1,000 a year in, whether you're single or family. So just for example's sake, let's use a 45-year-old. So 45, and let's say he can do the family amount. So he can do $7,000. And let's say he works until he's 65 and then he goes on Medicare. So in those 20 years, so 45 to 65, he's going to put the $7,000 that he can put in every single year. And I know that once he gets to 55, he can actually put 8 in, but just for simplicity, he's going to put in total $140,000 of his own dollars. He's going to pay no income tax on that. If it's through payroll, he's going to pay no Social Security, no Medicare tax, no state or federal if your state has income tax. So 140. This is also going to be invested. These funds are going to grow tax-free just like the 401k. So we can allocate these funds the exact same way. There's a lot of really good options on the market right now to invest these funds. So this number is going to continue to grow throughout retirement. So let's just say he gets to 200,000 in his HSA. That gets us pretty close to that number, and we can use some of our retirement account to help pay for the bills if we need to, but definitely want to be maxing this HSA whether we have a match or not. If we don't get a match through our employer, we definitely want to max this before we move to the 401k or the IRA. Just an overview, just something to think about as you're starting to prepare for potential medical bills and costs in retirement.